Good morning. Welcome back to day 2 of the conference. It was great to see so many of you join the sessions yesterday. I hope you took advantage of some of the networking opportunities and plan to utilize those sessions again to connect with our sponsors, our speakers, and other attendees throughout today. I know that I'm planning to join the virtual networking lounge throughout today and really hope to see a number of you join me in conversation there as well. We do apologize if any of you experience any technology challenges while trying to access the platform. Our service provider has assured us that the server issue is being addressed, but in this new fully virtual world, we're all adapting, and one of the things that I really appreciate about the emergency management audience is just your ability to be nimble and adapt when needed. So thank you for your patience and for continuing to join us today throughout our sessions and as well as tomorrow. So with that, I'm excited to jump into our opening keynote session, which will address racial injustices and inequitable impacts of natural disasters. Here to facilitate the conversation is Leslie Luke, who is the Deputy Director of Los Angeles County Office of Emergency Management. So Leslie, I'm going to turn it over to you after a quick word from one of our sponsors.
The last several months have been challenging for us all as we cope with the global pandemic and now the social unrest and racial injustice sparked by the killing of George Floyd. We're at a defining moment in our history, and it is our responsibility to stand united and deepen our impact in the communities we serve. For more than 2 decades, Southwest community outreach efforts have centered on developing and nurturing authentic relationships with organizations committed to building resilient communities. With the increased dialogue around racial injustice, we've been able to lean on long-standing relationships we have with several organizations to help us as we listen, learn, and act. To support the transformational work needed, Southwest is donating $500,000 to our long-standing partners, the National Urban League and 100 Black Men of America. We believe long-term sustainable impact requires national strategies and local initiatives to create systemic change. The National Urban League and 100 Black Men of America are making positive contributions within Black communities across the country by implementing programs focused on education, mentorship, and leadership development. What's happening in our nation is extremely important, and while we know there's plenty of work to do, we're committed to being a part of the solution. Together, we'll continue to spread inclusion, hope, love, and kindness across the communities we serve.
Thanks, Brooks, and good morning, everyone. I'd like to welcome you back to the 9th Annual Building Resilience Through Public-Private Partnership Conference. I'd also like to thank you for joining us this morning for our panel discussion on racial injustice and inequitable impact of natural disasters. As COVID-19 continues to spread across the country, no sector, public or private, is immune. However, this pandemic continues to cause havoc in our communities of color. From the discrimination in our Asian communities to the high death rates in our Black and brown neighborhoods to the impacts on all of us. All of this under the backdrop of this ongoing racial injustice that are happening in our cities and towns. Today, I'm joined by a panel of distinguished experts who are going to share their perspectives and insights on how we can address these vulnerabilities. Presenting today with us is Rita Carreón from Unidos US, Leon Andrews from the National League of Cities, Jacqueline Patterson from the NAACP, and Dr. J.C. Burt from the Center for Disease Control. Butler, excuse me. You'll find their complete bios on the website. And so now to kind of allow as much time as possible for our presenters, I'm going to ask the speakers to kind of give us a quick overview and introduction and then dive right into their presentation. So Rita, why don't we start with you?
Thank you, Leslie, for that kind introduction, and I'm glad to join you and key leaders today for this timely and important conversation in our collective fight to achieve better outcomes for our communities. As the largest civil rights and Hispanic civil rights and advocacy organization in the country, Unidos US, or formerly the National Council of La Raza, has been at the forefront of responding to the COVID crisis and its disproportionate impact on the Latino community. We have nearly 300 affiliates in our network, community-based organizations that provide an array of services to millions of Latinos and others every single day. Among them are 23 federally qualified health centers, which are critical safety net providers in medically underserved areas. And all these local organizations are on the front lines of those helping Latino communities cope with the crisis, often without adequate funding or resources, and especially given the need and demand. So over the past week, I think we've all seen, in Florida and Arizona, in Texas and California, states where half of the U.S. Latino population reside, posting the highest positivity rates of COVID-19. As it unfolds, it is exacerbating existing disparities among our communities of color, highlighting a legacy of structural racism with respect to healthcare and coverage, wages, housing, stability, and economic supports. And while it poses challenges for many, it presents a unique and significant implications for Latinos, especially the undocumented. And nationally, according to CDC, and I hope Dr. Butler has some new data here, Latinos represent 35% of all COVID cases in the United States, for which race and ethnicity data is available, but we're only 18.5% of the US population. According to CDC data analysis from the New York Times, Latinos aged 40 to 59 have been infected 5 times the rate of whites in the same group. Latinos also make up about 28% of all COVID deaths. And furthermore, Latinos and Blacks are twice as likely to die from COVID-19 as white people, with more than a quarter of Latino deaths were younger than 60. Tragically, Latino children and youth are also getting sick and dying from COVID-19 at highest rates among children. As of July 1st, more than half of all confirmed cases of children between the ages of 5 to 17 and 43% of all cases in youth were Latinos. And still, the lack of accurate race and ethnicity data has obscured the true effect of COVID-19 on Latinos and our communities of color. We cannot be effective in our approach while we operate blindly to the real impact that we are seeing in our communities. That is why we at Unidos US and our affiliates have called out for both more disaggregated data from states and federal government to better gauge the extent of COVID-19 and its impact on our communities. And we're also to make more bilingual, culturally responsive information, resources, and strategies and outreach available to those who need it. Latinos are overrepresented in essential occupations where they're most at risk for exposure of the coronavirus infection. Among all Americans, Latinos have the highest share of workers in the most vulnerable set of industries: the hospitality, retail, food services, construction, and agricultural, and the lowest ability to work from home. The majority of Latino workers, about 84%, cannot work from home and are either losing their jobs or working in jobs that expose them to harm on a daily basis. This puts them and their families at significant risk for economic and health threats. A Somos Latino Decisions poll that was conducted in spring showed early on that Latinos were deeply concerned and worried about the health impact on themselves and their families. And today we're seeing firsthand how this pandemic has exacerbated Latino households' state of well-being, especially in mixed status households. And that's what I mean in terms of mixed status is where there are families that are documented and US born. Many lack access to healthcare and have the inability to get tested and access proper treatment, while also experiencing an increase in food insecurity from COVID-19 and the loss of jobs. So this pandemic has exposed an unequal social and economic foundations on which Black and Latino families must build their lives. This is not a matter of happenstance, but an underlying premise to the systems, the institutions, and the practices that undergird the public policy response to the worst public health and economic crisis in the US in 100 years. So what we have in common, as I speak with you today, is our passion to restore and recover our communities, especially during this time of crisis. We must recognize that we are currently in multiple crises, not just the pandemic and racial injustice, but also food insecurity, the cumulative trauma and poverty that has compounded over generations, and in marginalized communities and families. Today, we seek solutions. We hold accountability and find our voice to say, ya basta, enough is enough. So I offer a couple of suggestions on how to recalibrate, reimagine a better future for America. First and foremost, we must advocate on precise, accurate, and transparent data, including the disaggregation of data by race and ethnicity, for which is critically important for us to allocate resources and make life-saving decisions. We can no longer operate blindly and not uncover truths, and also to acknowledge that the uniqueness of individuals and communities that represent these data. Secondly, representation in the workplace and in the voice of community leaders matter, especially where decisions are being made and discoveries are uncovered. We know that diversity brings a new perspective and will make our workplaces more effective and responsive. So one thing every company can do is to ensure that we have concrete programs and policies in place to develop leaders of color and to invest in community-based organizations that serve and strengthen the communities that we live in. Thirdly, recognize the importance and the value of essential workers, many of whom are Latino. Businesses should ensure that their workers have protective equipment and that essential workers are compensated fairly, especially those workers who are on the front lines. And lastly, demonstrate support for our African American, Afro-Latino, and Black communities. Donations and partnerships to organizations that serve these communities is a start. For employers and businesses, this could also include ensuring that Black employees are treated fairly and that there is representation at all levels, including among leadership. So again, thank you for the opportunity to be here today and to discuss with my colleagues a better pathway that we can collectively aim for.
Thank you, Rita. Why don't we transition over to Leon? Leon, why don't you give us a little background about yourself and then kind of hear what you have to say for the group.
Thank you, Leslie. Good morning, everyone. Thank you, Rita, for those comments. Great to be with you. I'm Leon Andrews. I am the director for REAL, which stands for Race, Equity, and Leadership at the National League of Cities. REAL has been around for the last 5 years with the backdrop of Ferguson and many other moments of racial tension that has been happening in cities across our country. I come to you now with reflecting on the last 3 months, 19 weeks, and kind of where we are, and really appreciate how Rita really framed it. It's really important to name, with over 3 million cases and over 137,000 deaths. The coronavirus pandemic continues to impact every state, every community across this country. Elected officials at all levels of government have been calling on the Center for Disease Control and the federal government to collect data that's disaggregated, as you heard from Rita, by race, ethnicity, and gender, to see the true impact of COVID-19 on communities across this country. And what we have seen is that the data is consistently showing this pandemic is disproportionately impacting communities of color, in particularly the Black, Indigenous, and Latinx communities. REAL, our department here at the National League of Cities, our entire organization has prioritized this as critical, important to make sure we're getting data that's disaggregated, but we also are prioritizing the need to target resources to the populations that need it the most and to prepare for rebuilding that ensures equity is prioritized and centered. So in the last few months, we've seen states and cities that are where there are a disproportionate number of Black residents, Latinx, Indigenous, people of color that are affected and dying to this virus. But we knew even before the coronavirus, we knew that race was still the strongest predictor of one's success in this country. From infant mortality to life expectancy, race still controls one's success in this country. The H1N1 in 2009, the death rate of Native people was 4 times the rate of all of the other racial ethnic groups combined. Hurricane Katrina, billions of dollars were spent in the recovery efforts during that hurricane. However, the racial inequities were exacerbated. Black unemployment 4.5 times higher than white unemployment. Black unemployment rates were 3 times higher for white unemployment after. Racial wealth gap increased from 25,000 to 35,000 among Black and white community residents. So the legacy of institutional and structural racism is playing out in front of our eyes again in the midst of this pandemic. And so this, for us, when we look at the coronavirus, it's important to see COVID-19 is the virus. but systems failure is the crisis. And local leaders must call it out, request data, make data-informed decisions in this moment and moving forward about what citywide initiatives should be prioritized. But what we have seen through this pandemic, it has shined a light on what is possible. Across this country, we have seen local and state officials meeting community members' needs, basic needs, in ways we did not know were possible, from the rent moratoriums, foreclosure, eviction protections, to police not arresting community members for nonviolent offenses, to how we're releasing people from jail that are being held with pretrial because they are unable to pay bail, or releasing people from prison that have pre-existing health conditions, nonviolent offenses, or how schools are responding across our country, providing students with computers and Wi-Fi hotspots to increase their access to internet and broadband for distance learning, suspending water shutoffs over COVID-19 fears, committing to house more homeless individuals in empty hotel rooms. So as we prepare for rebuilding, it will be important to look carefully at what policymakers were able to do during this time to address the inequities as we commit to ensure that it's sustained. And so while we acknowledge everything through that's been happening through COVID-19, the events of the last month have served as a horrific reminder of how important it is for cities to acknowledge and take meaningful action on racial injustice. The protests in over 1,000 cities, towns, and counties now, large and small, across this country is not just about George Floyd. It's not even just about Breonna Taylor or Ahmaud Arbery or so many other tragic moments that have happened in our that has not even garnered national attention. Many believe that this is an inflection point in our country's history. And so the question for local government and the work that we do is, what can municipal leaders across this country do using this unique opportunity that they have to engage their communities on racial inequity issues and make smart policy decisions that can reduce racial inequities, not just in policing. As you heard from Rita, this is a much larger social determinants as we look at the broader issues across all of our institutions. And so city leaders must be willing to step up, to take the lead with their departments and their communities to address racial inequities, and really see this advancing racial equity as a national effort, not a one-time fix, but a sustained investment in the work of achieving equity that will take time and involves and will continue to evolve and requires this long-term commitment. There's no universal solution. Every city needs to commit to their individual community's needs and the approach to racial equity that will look different in each city. The solutions includes a very comprehensive commitment to looking at institutional and structural racism, but is committed to centering equity and looking at our criminal justice, our public safety, our employment, our housing, education, and healthcare. So we at the National League of Cities, through REAL, have created a number of resources to help city leaders respond to the racial tension, respond to how they're prioritizing equity in their response to COVID-19. Through our resources on our website, we encourage you to check that out at nlc.org/REAL. REAL is working very closely with individual cities across this country and a number of partner organizations to customize how we're supporting opportunities for city leaders to really take action that is committed to reducing and eliminating racial disparities and healing racial tensions in their communities. For us, cities, this is an opportunity. Both the opportunity through COVID and the uprisings to change business as usual and embed racial equity into how they assess needs and how they allocate resources so that those who are disproportionately burdened will be centered in the recovery and in our rebuild. So NLC is here to support local leaders. We look forward to working with you as you grapple with these issues during these very challenging times, and serve as what we hope serves as the latest reminder for our country as we continue to wrestle with the legacy of structural racism and exclusion. So grateful for the opportunity. Thank you for the opportunity to share our work. I look forward to any time we have for discussion.
Thanks, Leon. Why don't we move right over to you, Jackie?
Great, thank you so much. Last fall, I participated in a retreat that was entitled "Navigating the Great Unraveling" as it related to climate change. And during the context of that conversation, Diedrich Asante Muhammad of NCRC said, yeah, it's great to talk about navigating the great unraveling, and we need to recognize that some communities were never raveled, and that is the context in which we find ourselves. With as African American communities, we suffer under the history of redlining and other disinvestment in our communities. As was stated by Leon and Sister Rita, we Black communities are less likely to have local food sources, less likely to have healthcare, less likely to have employment, yet more likely to have contaminated air and water, extreme energy burden, lower property values, higher prevalence of toxic facilities in our communities, and compromised health conditions and overall well-being. As Brother Leon said, that systems failure is the crisis under which we find ourselves. And so as it relates to natural disasters, that means that we have pre-existing vulnerabilities that make us disproportionately more vulnerable, more susceptible to the impacts of natural disasters, whether it is the fact that we're more likely to live in floodplains, where now we're experiencing a situation where 100-year floodplains are happening every other year. We're more likely to be in communities where in 2012, I was in Louisiana after Hurricane Matthew, and I was in Plaquemines Parish where the community was inundated, and someone on CNN asked the question of Senator Mary Landrieu as to why it was that the levees weren't fortified 7 years after Hurricane Katrina. And she said she asked the Army Corps of Engineers the same question, and they replied that they use a formula to decide which levees were fortified, prioritized for fortification, and the formula that they used applied points based on what the economic impact would be if the levee was overtaken. And so right away, that means that we are the people with lower property values are systemically less likely to get the types of protection that's needed. As Dr. Bullard, who's called the father of environmental justice, says, we are the wrong complexion for protection. We also have pre-existing vulnerabilities, including the lack of transportation or lower mobility, which is what put 1,800 folks in harm's way that resulted in fatality after Hurricane Katrina. One of the factors was the lack of being able to actually evacuate because of transportation challenges. And then when we have toxic facilities that are more likely to be in our communities, that means that facilities like nuclear reactors that are more likely to be in our communities are ticking time bombs. I was in Port Gibson, Mississippi, a very low-income African-American community with low mobility again. And after the flooding of 2011, we saw the Red Cross that was in front of the courthouse there with just like a table and 2 chairs. And we had already spoken to a couple of people who weren't able to get resources to do sheltering there after so many people were displaced and inundated. And we asked the question as to why it was that such few resources were going in this community that was really overcome by the flooding. And they said that Red Cross has a policy, which is a completely legitimate policy, but this to say that they don't set up operations in places within 7 miles of a nuclear reactor. And so that's fine in terms of a Red Cross policy, but it means that means that people should not be in harm's way within 7 miles of a nuclear reactor if this is the kind of threat that we find ourselves under there. And then when we talk about response systems, we know that there has been disparities around displacement of disaster recovery centers. There's been disparities around who gets approved for individual assistance. There's a built-in bias towards homeowners versus renters in terms of the types of support people can get. There's a challenge around people having to apply for small business loans in order to be able to get the resources that are needed to repair one's home. And then we have on top of it all the racial profiling that shows up in post-disaster context. We know that after that the folks who were trying to escape, were trying to get back into town to check in on their relatives, African-American unarmed folks, ended up being shot on the Danziger Bridge because of being racially profiled as being looters. And they literally paid the price of racial profiling with their lives, like so many other people that we're talking about today. And then we have the community populations that have faced further disenfranchisement, from women who are more likely to face violence after disaster, sexual and domestic violence, the incarcerated persons who are more likely, who were actually abandoned after some of these disasters and left for days while the sewage tainted waters rose. They didn't have food or water and low ventilation. People who are undocumented, who have been subject to ICE raids in post-disaster context, in disaster context. And then when we talk about post-disaster, our communities are more likely to have faced displacement long-term. And also we have political disenfranchisement from redistricting. So I'll just wrap up with a few recommendations now that I'm speaking at the pace of an auctioneer. We need, as President said, deep infrastructure investments and really looking at community wealth building and explicitly anti-racist investments. We need to plan for the entire disaster continuum, from thinking way before a disaster comes to way after. We need to think about intersectional analysis. We need to have policy making around avoiding displacement and putting in a flood management infrastructure and avoiding redistricting and the ways that the political impact happens. We need differential planning in the context of the COVID-19 reality. As Sister Rita was saying, we now face the inability to congregate, which means that for heat waves, we can't have cooling centers. For natural disasters, we can't have disaster recovery centers. So what does that mean in terms of how we're planning for contingency planning? We need to make sure that there is unfettered access to the commons. So we need to start building up communities so that communities have local food, communities have local energy that they own, so someone can't flip the switch and turn them off of the resource, the life-saving resource of energy. And we need to have inclusive community-led decision-making. And as others said, making sure we're prioritizing BIPOC vendors, businesses, employment opportunities at all levels. And any organization getting resources to respond to disasters has to have documented equity measures in place, including anti-racist measures. So thank you.
I appreciate it, Jacqueline. Dr. Butler, why don't we segue over to you?
All right. Well, I understand the time is tight, so I'm going to keep it really focused here. Following what Rita, Leon, and Jackie said, I think I could summarize everything that I'd hoped to say in one word, which is amen. I really appreciate the honor of being able to be a part of such a distinguished panel. I think I want to make a couple of quick points. First of all, to state the obvious, the underlying health challenges that we face in our country in no way disappeared in the face of COVID-19. I think for a number of months, we may have forgotten about them, but very early on, we saw outbreaks of COVID among people experiencing homelessness, among incarcerated people, among workers in critical infrastructure. And I think this shows how it really shines a light on some of the challenges that we face with health in our nation, and it particularly impacts people of color. As already has been mentioned, I'm not going to go through all of the statistics, but I think it's important to recognize that the risk of infection is higher for people of color, in large part because of the situations that they're in. And this can be indeed a part of structural racism. When we talk about ways to protect ourselves, such as teleworking or social distancing, we have to recognize that those are also the ability to do that is the sign of privilege. We have data from the Department of Labor that shows about a third of all white Americans are able to telework, but only about 20% of African Americans are able to do that. And a larger proportion of African Americans work frontline retail work, in public transit, in trucking, and are healthcare providers. So the risk of exposure is much higher. Underlying health conditions are one of the supporting poles of the health inequity in our nation. And we know that these same underlying conditions increase the risk for hospitalization as well as death from COVID-19. And the emerging data indeed show that risk of hospitalization is greater. And CDC was able to get data from 16 states that disaggregated data and we were able to release that on Monday to show that rates of death are higher among people of color. In terms of what have we been able to do, I think it's important to recognize that this is not an issue that's just going to go away. And one of the things that we did in the incident response, I know everybody in the audience is familiar with incident command structure. What we do at CDC is very similar. We do have some positions. When I was incident manager, for instance, I had a chief medical officer and a chief science officer to help us across the spectrum of the 1,000 responders to think through some of the high-level issues related to clinical medicine as well as the emerging science. But we also created a new position. Dr. Leandris Liburd, director of our Office of Minority Health, agreed to come join the response as a Chief Health Equity Officer. And one of the things that Dr. Liburd did that we didn't discuss before she presented some information to me, but I absolutely loved, was more than just what do we do over the next couple of weeks to address the issues surrounding COVID-19, but also a 2-year plan. And I love that because it recognized that we're not going to be able to make 400 years of inequity go away in just a couple of weeks or with a single appointment at one agency, that it's going to require cultural change to be able to achieve those goals. So the last thing I'll say, I realize we're out of time and we're going over now. I heard very early in the pandemic, as it reached the United States, the statement that, well, we're all in the same boat. And I wish that were true, and it's a nice unifying statement. But the fact is, I think there's a different analogy that really is more true, is we're all out at sea in the same storm, but we are in very different boats. Some of us have boats that can weather the storm. Others are in boats that when it was sunny and calm, we were up to our gunnels in the water, and people are being swamped now. So it's going to require us working together. This is not a problem of them, it's a problem of us. And that's the way forward. And my sincere hope is that what we learn from COVID-19 is much more than how do we manage emerging infectious diseases? How do we improve our public health informatics structure, which I think has also been, I had a bright light shown on it, that how inadequate it is trying to track a pandemic using 1995 technology, but also that we can begin moving forward to achieve the goal of optimal health for all. So I appreciate the chance to talk. I also appreciate a little bit of extra inning time there. It looks like we're about 4 minutes over, but I will stop with that. And I just look forward to working together with partners such as those that have been able to join on this panel discussion today.
Well, thank you, Dr. Butler, and I'd like to thank all of our presenters today for their presentation and participation. And for those of you in the audience who have joined us, I want to thank you as well. And with that, we're going to head into our first set of breakout sessions for the day. You can find the list of breakouts in your agenda view, and you can click and join from there. Following the breakout sessions, we're going to take a 30-minute break, but be back at 1 p.m. Eastern to resume our regular programming. So thank you, everyone, for joining us today.